My name's Dr. Ruth Large. I'm an emergency physician and a rural hospitalist, so I work both at Thames Hospital and Waikato Hospital. I'm the Clinical Director for Information Services and Virtual Healthcare here for the Waikato District Health Board. Yeah, it's a good question. I think it can be a very confusing term, but if we think about digital health as being any form of healthcare that you can deliver through information or communication technologies, then that kind of makes it easier to understand. So it's a very broad concept, and we often think about digital health in the concept of a patient, so a patient's digital health. So we might think about, for example, tools that they can use to measure their health. So that can be as complicated as blood pressure cuffs and blood sugar levels, or it can be as simple as electronic scales. Now, in today's age, we've got these devices here, which actually have as much computing power as I grew up with when I was a child. And this has meant that we can do so much more with the tools that we have because of the processing speed and because of the memories that sit within these devices. Now, digital health is a little bit different to what we think about in terms of health informatics. And that's a relatively new word also. So health informatics is about the design of those digital processes that we use. So virtual healthcare is a relatively new phrase, and it's a phrase that's grown out of communication tools, principally married with information. So these are tools that we use to create a feeling of being close to a patient and delivering healthcare when perhaps we are apart. And it underlies or it fits in very well with telehealth also, which is the delivery of healthcare when a patient and a clinician are in two different sites. There's lots of different ways you can deliver virtual healthcare. So some people, for example, might consider emailing a form of virtual healthcare. So I email my GP to say, can I have a new prescription for my blood pressure medicine? And that prescription then goes through to the pharmacy. But it also can include video conferenced conversation or text-based conversation, which may be informal or formal and adds to the patient's ability to care for themselves really with really good advice and clinical judgment. I think sometimes people get really scared of the concept of digital health. They think that they need to know a lot about how it all works, but actually that's far from the case. So I think all that really is required is an interest. So how to make the world better, how to make a patient's life easier, and how that could be done through an information or communication means. You don't have to have a huge amount of technical knowledge because there are lots of great people who've got that technical knowledge who can help you. So there are all sorts of venues to be able to do this. Some is just within the universities. A lot of universities and technical colleges now have opportunities in the digital health space. But also there's places like consumer councils or just the local community groups where you can perhaps start talking about how you can make changes in how you deliver healthcare. I think that it's a really exciting place to be. It's a growing area. You really don't know what's around the corner, and I think if that excites you, if you've got the motivation to look at something different that you can see results for in quite a short period of time, then looking at delivering healthcare through a digital means is a great way to go. So I guess that's a very long-winded way of saying that I would encourage people to just think about it. Yeah.